Welcome to the overview of collaboration and joint planning. Section 4 of the guide emphasizes the importance of collaborative planning with the children and families served, as well as with the Children's Bureau, service providers, courts, the education system, and health and well-being systems that play a role in the tribe's efforts to ensure the safety, permanency, and well-being of those served. Tribes must engage in a formal process of collaboration called joint planning. It is the ongoing partnership between the Children's Bureau and the tribe to develop, review, and finalize the 5-year Child and Family Services Plan, also known as the CFSP, and the Annual Progress and Services Reports, or APSR. When developing these plans, there are two important questions to ask. Is the tribe's child welfare service delivery system comprehensive, coordinated, and effective? And are there any gaps in services or areas where the system can be strengthened? If any gaps are identified, they should be addressed. These important collaboration and joint planning discussions include key topics such as identifying the needs of children, youth, and families, identifying service needs that the tribe plans to address, developing goals and objectives that will improve outcomes for children and families, and addressing how the tribe will support the grant and fund the 25% match requirement. Joint planning to develop the CFSP and APSR can be accomplished in a 3-step process. The initial step in developing the CFSP is for tribal staff to meet with the Children's Bureau Regional Office Program Specialist to review the program requirements. In Step 2, the tribal program staff will establish and meet with their Title 4B plan development team. This team could include tribal child welfare staff and managers, persons with lived experience, elders, tribal leadership, tribal finance staff, and other important community partners. The goal of this meeting is to review the process, include any additional partners, share any relevant tribal data that could inform grant activities, and develop a work plan to complete the CFSP that includes timeframes and major tasks and establishes roles and responsibilities. Tribal program staff conduct the same process each year for the APSR, including the additional requirement of sharing any accomplishments and lessons learned from the previous year's report. In the third and final step, tribal program staff will consult and coordinate with other tribal programs, such as partner agencies, including all appropriate local offices or state-county agencies within the tribal service delivery system, state, local, tribal, and community-based organizations administering programs that provide services for children and families, and lived experience experts, including parents, birth and adoptive, and representatives of professional and advocacy organizations. Finally, it is important to understand that joint planning is an ongoing process that is accomplished through collaboration, and the planning team can continue to meet and help guide the work throughout the grant cycle.